Good morning, everybody. Fortunately, the updates will be brief this morning as we have made tremendous progress. And I would like to take a point of privilege to echo all of the sentiments echoed in all of the proclamations, particularly related to mental health and the need for us to make sure that we have resources in place to continue to address where we were before COVID, because we knew there was a shortage of resources, and certainly to help us get through the rest of COVID and tackle that issue as we move forward. And the second issue is to also just express my thanks for working with Dr. Smith during my tenure here in Montgomery County. I am happy to say I had an opportunity to work closely with him and his staff before COVID and get a chance to know them and their team, and certainly working with them throughout the COVID response, and how committed they are to their students and the residents of the county. And so I know he may have gone off, but thank you for your friendship and your collegiality and partnership during that time. Now to pivot, let's see if I can do this here. I'm going to attempt to share my screen again and F11 like we did last time. So I just want to go over a couple of things here in terms of where we stand in terms of updates. Community transmission levels continue to be in a good place. We had 26 cases reported yesterday. Our transmission rate, our test positivity is actually at 1.37%, and our case rate is 3.5. And you can see that is in the low risk of transmission category. As noted yesterday in the memo that was sent to you all, we now have achieved what we believe to be over 60% of our residents receiving at least one dose. Now, for the folks watching at home, they may say, well, why does it say 59% and that's not 60%? Well, if you look to the right of that, we have talked about how we're using the CDC estimate of our fully vaccinated folks. The difference is that the CDC estimate takes into consideration residents who may have been vaccinated in other areas. For example, we know that we did have a good portion of our residents, at least early on through occupational vaccine opportunities, be vaccinated in other places such as the District of Columbia and Northern Virginia. And so looking at that number, which we did hit 50% based upon that estimate on this past Friday, and looking at how close we were to the 60% threshold, we felt confident that we have at least 60% of our residents having received one dose. And as I mentioned, we have also achieved 50% of our residents receiving both doses or a single Johnson & Johnson dose as of last Friday. Now, to remind folks again, to be fully vaccinated, that means one is 2 weeks out from receiving that single Johnson & Johnson dose or both doses of either the Pfizer or Moderna dose. And we would hit that goal on May 28th, the Friday before Memorial Day. The other thing that I want to pull out and highlight is if you look at the percentage of our residents who are 17 and up, this doesn't include our 12 to 15-year-olds who we know were made eligible for the Pfizer vaccine on last Wednesday. We as a county apparatus began providing doses to that population on last Thursday. And between Thursday and yesterday's clinics, Thursday and Monday, we had provided vaccines to 9,474 12 to 15-year-olds. And again, that's just from the county clinics. We don't yet have a full calculation of all of those who may have been vaccinated in other pockets throughout the community, whether private providers or through pharmacies and other places, but we're working on that number. We will be partnering with a MCPS to have a vaccine clinic at Argyle Middle School on tomorrow, and we are partnering with one of the non-public schools, Stone Ridge School, on today to have a vaccine clinic as well. Throughout both of those clinics, we hope to be able to provide vaccines to roughly 2,000 young folks who fit that age category. Now, also want to highlight one of the issues that has come up. Someone has we've received some emails related to young people being able to get vaccinated without parents being present. What I want to make sure folks understand is that In those situations, children still have to have consent offered by their parents. And so consent must be completed in order for them to move forward, as well as age attestation. Moving forward, just again, a couple of other markers to show how we're shrinking the gap by race and ethnicity, and we've seen continued improvement of that over time. And when we can start to see how we are continuing to see a little bit of a drop as plateaued a little bit over the last week in terms of individuals coming in for first doses, and still making good for those who have come in for their first dose, still getting 95 to 96% of those folks coming in for their second dose. And we think this plateau is because, again, we've seen this influx of new people, being 12 to 15-year-olds, being eligible, being able to stave off some of the decline in interest. And that bears out when you look at the volume by age. In the last week, we see a probably over, I'd say maybe 40% of our folks coming in for first doses being those young people between the ages of 12 to 15. We do have to continue to follow up. We had discussed providing some more insights to you all related to the specific zip codes. That analysis continues because at this point we are seeing some pockets of zip codes have really great saturation of being vaccinated, and other areas, as evidenced by looking at some of the red zones, still don't have as much uptake of at least one dose in comparison to others. So please stay tuned on that as we continue to work through that analysis to understand if there are any particular trends or phenomena that are happening within those respective zip codes that can be addressed to help increase the percentage of residents who are vaccinated. And then this just breaks down again, showing you where folks are getting their vaccine doses. And it's important to highlight again, when we look at the source for those who are 12 to 15 or under 16, the majority, approximately 70%, 69% of those folks are getting their vaccine through the county apparatus clinics. We do hope that as private providers get access to the vaccine, that number will grow and more folks will be able to have opportunities to get vaccinated and covered within that space. Again, this just shows you where we stand in terms of the number of doses that we have received overall and how we're putting those doses out. And again, when looking at our equity framework, this pretty much, unfortunately, has stayed the same in terms of those zip codes that have been hit the hardest based upon COVID community transmission levels and case rates. All right. And just one couple things to highlight at the conclusion of that is that we did provide guidance related to how to move forward. And I know you all are considering the Board of Health resolution today in the face of all of the things that have changed since we met last Tuesday. It is an evolving, you wake up each morning and there's something new. But I would like to clarify a couple of things and why we put forward the guidance, particularly around face coverings. We know that even though we are obviously excited to be at a point where we can say 60% of our residents have received at least one dose of the vaccine and 50% have been fully vaccinated or moving in that area, that still underscores that we have a lot of folks in our county who have yet to be vaccinated and yet to receive a dose. And when we're talking about 40% of residents not receiving at least one dose, that's 400,000 people. That's a lot of folks. And so we still have a lot of work to do to make sure that we extend opportunities to any individual who is interested in getting a vaccine. We continue to provide education and outreach to any individuals who have questions or hesitance about receiving a vaccine, because it's important to get as many people protected as possible so that we can drive our community transmission levels even down further from where we are right now, so that we don't have to be dealing with or potentially looking at an influx of cases later on in the summer or in the fall as we continue to open up provisions and increase capacity and open up society. Now that gets to the second point in terms of face coverings. Why do we still recommend that folks wear face coverings, particularly for those who are unvaccinated? Again, we want to cut down transmission as much as possible. We know that face coverings are an effective tool in doing that. And certainly if you've not been vaccinated, you still are in a higher risk of contracting COVID and being able to transmit it to other people within your network and within society. And so we have continued to support the notion, particularly in indoor spaces, that unvaccinated people should still wear face coverings. And we know that many other people, even those who are fully vaccinated, will choose to do so as well. And they should be supported in that and not shamed if they decide to do so. Now, I know that the state also has put out some clarifying language based upon the CDC's announcement on Friday, and that includes wearing still a requirement of face coverings in certain settings, regardless of your vaccine status, including health type facilities, as well as school settings. And there are a couple of other places as well that they still are supporting the idea of requiring face coverings regardless of your vaccine status. So I just wanted to put that out there and let folks at home know that, yes, this is all confusing because these things are happening very quickly, but we are working to make sure that we continue to have the guidance in place to keep you and your family safe as we continue to move forward and open up more things throughout our county. I will stop there, but happy to answer any questions that you all may have. Thank you.
I have just a few updates to provide in addition to what Dr. Gale said. So we've actually been working with an external behavioral health scientist who has been working with both the county's communication network as well as the individual minority health initiatives to develop messaging targeting those who have so far not come out and gotten vaccinated, providing messaging expertise and some feedback on what kinds of potential incentive programs might be utilized for those various different individuals as well. One of the key messages is that depending on the individual and depending on their sort of the basis for their so far unwillingness to get vaccinated, and obviously many of those are still access issues, not all cases that is it the quote unquote hesitancy we've talked about. But one of the key things that we've learned is that both the incentives and the messaging have to vary by the individual. And obviously, we're taking a hard look at what those kinds of both incentives and messages should be in various populations. But even for people within populations, what message is going to most serve the interest of getting that person to come in and get vaccinated as we bring the vaccine closer to them. I did want to provide my support for what Dr. Gale said. And the governor mentioned this as well. As we move into this environment where we're going to have people with face coverings on and some without, please do practice a level of kindness with one another. Some people are going to be comfortable removing their face coverings when vaccinated. Some people are going to be uncomfortable removing their face masks, even though they're vaccinated at this point. The goal is for us to, sort of demonstrate that we can be successful with the transition to the CDC guidelines. But just understand that, there's going to be some people who have trepidation about this and are still going to want to wear their face coverings, which they're totally permitted to do. I think, as Dr. Fauci previously said, we may have some people who want to wear them more regularly in the winter now because of what we saw happen with flu this year and the level that it protected us. And so I know many, particularly in Asia, many communities do have it as a more routine part of their societies that people can wear face coverings, not required to. I think that's where we want to go. But obviously, we should be comfortable with the fact that some people are not going to be ready to move beyond face coverings in the short term, and therefore we should be comfortable, with one another and not be disrespectful and accusatory. So I think, obviously we're making tremendous progress. More than 18,000 doses of vaccine over the weekend, including first and second doses. I do want to provide a special thank you, and we don't often do this as much as we probably should, to the vaccination teams that worked extra hours over the weekend, late evening hours throughout much of last week and into this week. And so I want to make sure that we credit them for the work. They're missing time with their families and things like that in order to provide people vaccines. And so I just want to acknowledge those as well. I'll stop there, and I think we can take some questions.
Thank you. Dr. Bridgers, thanks for joining us. Anything to add?
Good morning, Council President Hucker and other members sitting as the Board of Health.
Yes, I would. Dr. Gales and I had conversations late last night and this morning regarding our homebound vaccination program, and to include Dr. Stoddard as part of our vaccination planning leadership team. Just wanted to crosswalk everyone this morning regarding the status of our homebound vaccination program. And we understand that it's been somewhat slow. We started off with our minority health initiative partners conducting a pilot for our homebound population of those who pre-registered. We had about a little over 1,300 pre-registrants. And since then, we've vaccinated about 2/3 of our homebound population, to include those who are caregivers. Just recently, we looked at our numbers, and we have about 397 homebound individuals and their caretakers who still need to be vaccinated. And so what we've done, as we've done throughout our testing and vaccination platform, we've used a process evaluation strategy where we've looked at our numbers and looked at our approaches and looked at the best way forward to increase our capacity to either test or vaccinate individuals. And so we are ramping up our vaccination program for our homebound population. We will be vaccinating effective today or this week, those individuals, those remaining 397 individuals and their caregivers who are required vaccination. We use a priority framework to include those high priority zip codes and those priority census tracts, but we are now including those individuals who've been sitting in the queue and waiting for the past 30 to 45 days to get vaccinated. And so we are including those individuals in our scheduling strategy. We have targeted 120 individuals this week. And then next week, we should have about 177 individuals remaining, and we're going to identify those individuals. We're going to look at those local vaccination places where we haven't received higher numbers being 500 or more vaccinations per day. And we're going to divert clinical staff from those areas to go out and service teams that we've done before, those strike teams that we've identified and used to test and vaccinate individuals in those assisted living facilities, nursing homes, and congregate living spaces. Now, keep in mind, we did have already responders who supported our efforts in the past along those lines. However, due to regulatory challenges, we were advised by the Office of the County Attorney that we could not use or include them in our vaccination scheme, where we've realigned those capabilities since they can be supervised at our clinical spaces. And we're going to backfill those individuals to augment the clinical staff who will be diverted as part of our ramp up to vaccinate all those individuals who continue to be homebound and haven't been vaccinated. Our plan is to target the end of the month, but realistically, it may not be until the week of June 5th going forward. And lastly, anyone who is listening this morning who still have not received the vaccination, our call center is still operational. They should contact 240-777-2982. Our call center staff will be following up with individuals who we've tried to reach repeatedly and who have not responded to our survey, and we will be contacting them to get them in the queue to be vaccinated. I'll stop there, subject to any questions the council board may have.
Thank you so much, Dr. Bridgers, and all of you. Let me just jump in with a couple of quick ones and then call on my colleagues. I didn't hear this addressed, and I haven't in a little while, so I just want to check in. It's on my mind. Where are we with our own employees being vaccinated, particularly our frontline employees? I was surprised last time I asked this how many hadn't been vaccinated, and I don't know how much that's operational difficulties and how much it's hesitancy. Can one of you answer where we are with our employees, particularly the frontline ones, and what we're doing to get to the rest?
So all the employees have been offered an opportunity to be vaccinated, actually multiple opportunities to be vaccinated, and we continue to encourage them to get vaccinated. We did not track it in all departments, mostly because by the point where most departments were eligible, there were so many other places you could get vaccine that we would have to essentially take the state list and reconcile it against the county employment list, which brought some significant HR and legal questions about how we would be, what we'd be doing as the employer of those individuals. I mean, looking at, for example, in our public safety network, we're over, I think, 71% of our law enforcement officers, 75% of our public safety, our fire rescue staff are vaccinated, which, if you look across the nation, is an order of magnitude higher than most places around the country. And so we continue to offer opportunities to our employees. Actually, we've got another, I think HR just sent out another reminder of the importance of getting vaccinated. And obviously we're working on some additional, reopening materials. And in those materials, we encourage people as part of those reopening activities to get vaccinated, because, we will be returning more. I mean, telework will be part of our future for a whole host of reasons, for convenience, but also climate change and all those other things. But we do expect that we'll be back in the office more regularly moving forward. And so encourage people to be vaccinated who have thus far not.
Thank you. I'm glad to hear that about law enforcement and fire and rescue. Can you comment on where we are with librarians and ABS?
I don't know the percentage, because obviously what we knew that we saw many of them not come in, but we knew that many of them had gotten vaccinated through other means. So that's why we had a challenge knowing exactly what that percentage is. They've all been offered multiple opportunities, multiple clinics to come in and get vaccinated. So at this point, and obviously we're not going to change the way we decide to do our reopenings based on someone who refuses to be vaccinated.
Right.
That they can't use their refusal to be vaccinated as a means to justify their not coming back into the workplace for operational needs, like libraries, as you've noted. And so obviously that's been, something that we've been working on with both the employee unions, but also just making sure that, we have a path forward for the employees, both for the public and for themselves, feeling comfortable back in the workplace. So.
Right. No, thank you. I appreciate that. And that this is all relatively recent given the arc of the whole pandemic. And so I'm asking, I'm glad they've been offered multiple opportunities. I appreciate they've been able to take advantage of opportunities to get vaccinated through other means than the county government. But you're also saying we don't know the floor for those other departments. We don't know how many have been vaccinated by the county government, knowing that it's higher than that?
No, we don't know exactly what for each department, and whether it's department by variable. We're aware of employees who have just, in the office place said they weren't going to get vaccinated. So we do know that there's some employees who are refusing. We just don't know whether that's 20% or 30%.
Sure.
I think that's sort of where we're trying to figure out. I don't think there's any employee program, given the one place that you have seen across the country where you've seen more hesitancy than other places, particularly in the law enforcement sectors. I have no reason to believe that our other departments are going to be less willing to get vaccinated than our public safety partners were.
Right.
We have no reason to believe that from what we're seeing coming into our clinics and the behavior that we're seeing with employees in the workplace. So I would speculate it's between 70 and 80% almost across the board at this point for all, but I can't assert that with data that I can show you.
So why do we know it for public safety and fire and rescue and not?
Because we were the only people vaccinating at the time. They couldn't go to a pharmacy or some other places to get vaccinated. So we could track how many doses we gave out to employees in each department, because we were the one-stop shop at that point, right? We were the public safety clinics. They couldn't go to a pharmacy or something to get vaccinated at the time that the public safety partners had been doing it. So.
Right. No, I'm glad to hear. I hope you're right that none of the other departments are lower than the 70%. But isn't it true that didn't we offer it to law enforcement and fire and rescue first? And so haven't they had more opportunities than the other departments at this point?
They had an earlier opportunity, and they had a very specific, obviously they were going up to the academy at the time and being vaccinated. So yes, but obviously we've offered multiple opportunities that were employee-based clinic opportunities. Not to mention, I would argue that, they, at the time, public safety had a specific opportunity, but it was at one location in the county. Now they could go to any number of dozens of locations at this point. So it's probably more convenient at this point than it was then.
Okay. All right. I feel better about this. Thanks for all those answers. Obviously, it's great that we got to 60%. We expected to hit that milestone today, but we hit it yesterday, and we have a county full of overachievers. That's great news. We have more work to do ahead of us. But can you talk about when you anticipate getting to 65 or 70%? I realize the rate of increase will slow as we go higher.
Well, I think it's tough to call. I think that we will probably see a continued influx of folks coming in for that first dose, being the 12 to 15-year-olds. If you think back to that chart where we saw a plateau of the number as opposed to a dropping with them coming in. And again, just off of how many we've done just shy of 9,500 just for the county sites, not including what we had last night. That is approximately, we approximate we've got maybe 40 to 45,000 12 to 15-year-olds in the county. So we've still got a good percentage of those. I believe approximately 40 to 45,000.
40 to 45,000. Okay, thanks.
And so if we've done about 20 to 25% of those. So we still have a good amount of young people to come. And we speculate that we'll see again, probably at least another 20 to 25% of that population within the next week, which would allow us, I think, to climb, a little bit quicker to 65%. Now, I think after that is going to be tricky because again, we won't, I don't, as far as I know, a decision to vaccinate below 12 is not imminent for any of the vaccine candidates that are out there. And so we're going to go back to that issue of hoping to bring in more of those folks within that 17 to 35-year-old group that we've not seen a significant uptake in so far.
I will note that we have seen a bump in the other categories as we brought the 12 to 15-year-olds in, at least relative to previous weeks. Presumably those are parents coming in with the younger children who had not themselves been vaccinated and now are doing, we're getting the 2-for-1 deal on the vaccination, or older siblings or things like that. So obviously that's been a pleasant thing. We've also seen a bump, I believe, as we've offered more evening, different locations, things like that. So we had a much better week. Not even if you just exclude the 12 to 15-year-olds, we had a much better end of the week last week than you would have thought if you hadn't expanded to that category anyway.
Thank you. Yeah, it would be great, obviously, to get a majority of these residents vaccinated in that age group before the school year ends in a few weeks. Do you have any update on what's happening with MCPS and any notification of parents and pop-up clinics there?
So yes, we are doing a pop-up clinic at Argyle Middle School on tomorrow, where I believe we've got about 1,000 slots available. And we also are doing one with a non-public school on today, Stone Ridge School, where I believe we've got about 800 or so appointments available as well. And so we will see how those go and then be able to sketch out some further opportunities. Another thing, again, to emphasize is we're hopeful that private provider, that we'll see an uptick in private providers getting the vaccine as well, being an additional point of contact, an additional site that children can be able to access.
Terrific. Thanks. Councilmember Rice.
Well, thank you very much. So Dr. Gales, I'm a little bit concerned, and again, this has nothing to do with you or Dr. Stoddard or HHS in general, about the messaging that's out there and how confusing it is for constituents. And all of us have heard about it, because here's the challenge. So what we're saying is that we're moving forward with lifting some of our indoor requirements for folks, assuming that those folks that are in there would be vaccinated. However, we have hundreds of thousands of eligible residents that are not vaccinated. And so in theory, excuse me, you could have a large percentage of folks in a restaurant that were unvaccinated without the restrictions that we had in place months ago, before we had eligibility for vaccines. So nothing has changed in terms of the potential for what could be in those places, whether they're restaurants, whether they're businesses, whatever the case may be. So theoretically, in terms of who could actually be in those places, nothing has changed. And so you're changing the rules in terms of congregating and mask wearing, when in fact, there's no guarantee that those folks would actually be vaccinated. So how do you explain that to individuals who are trying to understand why it was that we had those restrictions in place before versus why we don't have them now?
Thank you, Councilman Rice. That's an excellent question. It gets to the heart of, I think, the challenge with recommendations. So at the first point, and some of this is tricky to explain because everything you said is right. So the first point in all of this is that the CDC's recommendations apply to those who are fully vaccinated. Now, you're like, okay, that makes logical sense. So saying you don't need to wear a face covering if you're fully vaccinated, because if you're fully vaccinated, you're not likely to transmit it, you're not likely to get it, so forth, all right? The challenge is, though, is how do you differentiate in a space between who's fully vaccinated versus who's not vaccinated? And that is the challenge. So on one end, I do acknowledge the idea if you are a fully vaccinated person, the data has shown that you're not going to transmit it to others and you can move about safely, even though we know that some folks still won't feel confident in doing that, and that will take some time. But you would be able to move about safely based upon the data that's been presented. But we don't have mechanisms per se in terms of how to differentiate between those who fit into those different categories. And so hence the recommendation that we put forward is that if you are vaccinated, you do have the option of being, without a face covering in different settings. But if you're unvaccinated, you're still required to do that. Again, recognizing that how to enforce that is still a gray area because we don't have a mechanism to go through and say, Councilmember Rice, are you vaccinated versus unvaccinated? Dr. Bridges, are you vaccinated versus unvaccinated? And it underscores why, at least from my perspective, we've again put forward guidance to say we still need to be respectful of the other public health guidance in terms of physical distancing and those kinds of things. And we can't throw out all of those practices, all at once and expect that everything will be okay and everything will be fine and we won't have to deal with this in the future. And so that is, I don't know if that answers your question. That's the best that I have with the data points that we have. And it is a tricky situation because there are the benefits of getting vaccinated. That's what we want people to get vaccinated to protect themselves and protect their families. And it's this delicate balance of, yes, moving forward, we want to get more people covered so we can open things up more and return to some sense of normalcy, but not open up too fully and recklessly and too quickly to set ourselves up for, potential cases to happen as things open up more throughout the summer.
Go ahead, Dr. Stoddard.
What we have done in the United States has not been risk elimination. We have not since the beginning of the pandemic, and candidly, I sort of wish we had done this in the beginning. We might not be suffering the way we are right now if we had taken it more seriously in the beginning and tried to, go with a no COVID strategy earlier, and we would not be where we're at. What we've been doing throughout the country has been largely risk mitigation. And so in light of the effectiveness of the vaccines, as Dr. Gales alluded to, and the fact that our community transmission rates are substantially lower than they have been at really any point since we've began testing, it gives us some confidence to think that we can take some, do some more broader reopening and allegiance following of the CDC guidance on masks, and not have the same degree of risks that would have existed had this been done last summer. That said, it is not without risk. Obviously, that is 100% true, and there are absolutely risks that we could see increases of cases, if not now, certainly again in the fall, and we may need to take additional actions again in the fall if that were to happen. I'm not trying to be doom and gloom about this. I think it's very likely that it won't happen, but it's not impossible, and I think we just need to be prepared for the possibility that we could see things get worse, and then we may have to talk about what actions would be necessary to control that getting worse. And so we're hoping not to go there. Other states, Texas removed its mask requirements months ago and did not see the spike. Now, does that mean it's going to happen the same way in Montgomery County? No, it does not. But obviously, we believe the risks are a bit lower now than they have been at any point during the pandemics, and so we can follow the CDC guidance and follow the vaccine guidance around, how many people are protected, and feel we can move forward with this measure and then assess our success or failure.
So I wanted to highlight something that you said. And again, this isn't saying one way or the other in terms of where we go. I just want to make sure, because we're getting so many questions from our constituents, right? Both individuals, businesses, the like, who are very concerned about what it is that they need to do now, right? What the best advice for them to do now is in terms of how to move forward. And I'll just say that our numbers were low, and we touted that our numbers were low because we required masks, because we required social distancing, because we kept some things closed, and because we required limited capacity. So conversely, if we said that that's the reason why our numbers were low, if we take those things away, does that mean that our numbers still stay low? I don't know. I'm not a scientist. I'm not a doctor. I'm not an epidemiologist. I have no idea. And so that's why it's really hard for us to be able to try and make these kinds of decisions. But as a person who does understand science, I do know that when you take out some of the things that are automatically assumed as a part of your initial experiment, and those are constants, and you take those constants away, there's the opportunity for the result to certainly change. And the thing that would change is that the numbers stay low. And I don't know, there are other variables that are out there as well. Folks are vaccinated. And so that is a key component as another variable that's out there. But we still have, and so Dr. Stoddard, you did some quick math for me last week. What's our math in terms of the number of eligible people that are still unvaccinated?
Oh, it's likely probably about 225,000 eligible individuals who have not been vaccinated. We've only done about 25,000 at most since then, so it's probably maybe 230 even. Yeah, no, it's still a significant number of people.
So hundreds of thousands of people are still in Montgomery County. I'm not talking about in others. I mean, look, all we have to do is look to neighboring Prince George's, where I think that their numbers, and I don't want to badmouth Prince George's, but the numbers are the numbers, right? We're talking about borders. They're only at 30% of their eligible population fully vaccinated. 30%. And so those folks are coming here just like our folks are going there. And so again, it's just one of those where I just say that because this is what I'm hearing from individuals, just as I'm hearing from individuals who are saying, let's move forward with opening. Let's go. Let's take off the masks. We're done with this. We've got folks vaccinated. I hear that side too. But that's why I'm just trying to get a better understanding of why it is and what justifications we have for us moving forward, understanding that there's still so many and still so many of the variables that are out there are still at play. So Dr. Gales, what would you say, A, to the business that wants to try and decide what they do regarding masks and social distancing? And then what do you say to the individual who is vaccinated about what it is that they should do to make sure that they are keeping themselves healthy and safe?
Well, and this is not a cop-out answer, but I think it really is up to the individual. And I think it's important to note, so thank you, Councilmember Rice, for laying out all of those different realities. Because we typically, as I think someone noted before, a lot of those who are most vocal are those who are against, what's happening. But then there are a lot of people who don't get their voices heard, who do, support what, the work that has been done before. And it is a delicate balance to make sure all of those interests are represented. And so I think the first thing it's important to emphasize for businesses as well as individuals, they still have the opportunity to put into policies that they feel will keep themselves as well as their clients safe. So if you are a business who still would like to emphasize physical distancing or face coverings within your space, you have the right and prerogative to do so, and you would be supported in doing that. Much like we talked about an individual who says, I'm fully vaccinated, but I'm still not ready to go out maskless, or I still don't feel comfortable doing that, whether it's in an outdoor and indoor space, you are supported in doing that as well. And I think it's important to, again, as we transition, you are right, none of this changed overnight. And even if we reopen or expand capacity from 100 to 250 in a particular space, that transition may happen from Monday to Tuesday, but the residual effect and impact on how we operate as individuals and businesses may not change instantaneously, and that will take some time, and there will be a transition period. Because you're right, we've not had this before, and we're still learning as we're moving forward and trying to put forward the best guidance as possible. So I say all that to say that, again, if you are businesses who still have concerns, you have the right and space to be able to continue to emphasize those public health practices such as physical distancing and requesting that your clients wear your face coverings when they go in the stores, and individuals, the same principles. It's interesting. I as an individual, I'm trying to figure that out too. So, I've been fully vaccinated since January, technically, but maybe it's out of habit or not. I still put on my face covering when I leave the house. I'm out in common spaces. I do work out and try to stay fit. I'm still going to wear my face covering when I'm in a gym setting, particularly around other folks where ventilation may not be the greatest. And so I think it's and to Dr. Stotter's point, I think it's an individual's risk assessment in that space, and individuals who still choose to do so should be supported, should not be shamed, or should not be stigmatized for choosing to do so.
I would echo Dr. Gales here. There are still some indoor environments where I, as a vaccinated person, will continue to wear a face covering, and I'll make those assessments based on how I view that individual situation. There are settings maybe where I'll take my face covering off at this point. I actually haven't, obviously this hasn't been policy yet, so I haven't been outside the house when the policy would be in effect in Montgomery County. And so, I'm sure there will be situations where I'll wear a mask. There may be situations where I don't, and depending on my individual comfort level, I think that's entirely appropriate. And so, yeah.
Okay. Well, thank you guys. And I really appreciate it. I think that, again, part of the challenge for individuals is that both of you as health experts in the field have a lot more to go off of, whereas you have individuals who've just been listening to guidance from folks who all of a sudden kind of feel as though they're kind of left to their own devices and just really aren't sure. And that's some of the unease that's out there. Folks just want to continue to have folks just give them the guidance in terms of, well, what's the best way for you to remain safe? Right. We've given them all this time. And now it's to them, again, I'm just telling you what folks are saying. They feel as though they've kind of been abandoned by CDC, by local officials, as folks say, well, you can make your own decision now. Whereas before it was, well, in the best interest of you and your family, this is what you need to do. And so hopefully, we will see good things come about. We will continue on the direction that we have. I agree with you, Dr. Stoddard. I hope that we won't see any of those increases and don't think we will, as long as we continue to get folks vaccinated and continue to increase that. I just hope that by laxing some of these restrictions won't mean that folks think that they need to take their foot off the pedal when it comes to vaccinations and that this is done. We need to make sure that folks understand we still have hundreds of thousands of people who have not been vaccinated that are eligible. Please go get your vaccination so that we can continue on this pathway toward reopening and making sure that everybody's safe. So thank you. Thank you very much. Back to you, Mr. President.
Thank you, Councilmember. Councilmember Reamer.
Thank you. Appreciate the dialogue. Apologies 1 second while I pull my thoughts together. So thank you, Dr. Gales, Dr. Stoddard, Dr. Bridgers, Dr. Kroll. I understand that ACIP has now approved distribution of doses to medical practices, and that our providers are basically waiting for the state to, make some kind of announcement. I was just interested whether you have considered, first of all, are we able to now get out all our doses? I'd be surprised if we are, just given the decline of interest, but maybe we are. But if we aren't, or even if we are, maybe, do you think it's a good idea to provide additional doses directly to providers, especially for medical practices that may have strong relationships in our immigrant communities and communities where there may be, a lower rate of vaccination. So any thoughts on that?
Thank you, Councilmember Reamer, for your question. A couple of, or your questions, your set of questions. So a couple of things in response to that. I'm just looking at my notes here. So private providers have actually been eligible to receive vaccine for quite some time now. And that decision and determination is made at the state level. So in the early stages of the vaccine distribution process, private providers were not eligible to get vaccines. The vaccines were shipped to health departments and hospitals, and then pharmacies and so forth were brought on. Private providers were presented with the opportunity to register in the state system, in the Immunet system, a couple of months ago. And there was a trickle, there was a pilot where they started releasing doses to a limited number of providers. I believe that was about 6 to 8 weeks ago, and that has gradually expanded. And so about 3 weeks ago, recognizing that there would be further provisions that would allow for younger kids to get the vaccine, the Board of Physicians, I know the Board of Physicians did it coming from the state. I received the letter as a licensed provider, encouraged pediatricians in particular and other providers who had not registered in Immunet to register, because once you are registered in Immunet, you can get the vaccine shipped directly to your office. It doesn't have to come through the health department or a third party. You get that shipped directly to you. So there was an effort, and I know the Medical Society also promoted this, to get private providers to register in Immunet so that they could get the vaccine directly to be able to administer to any of our residents. Now to the second, so that process has been in place for some time, and they're able to do that. And so in order for a provider to do it, they have to go in and register, and they get it directly. Now the second part of the question in terms of where our dose allocation and allotment where we are, we actually have been putting out the doses that we've received. We've been getting at a fairly almost 1-to-1 rate, and in particular, given this influx of young people into the system, we've not had any issues with that. We have actually been partnering with our some of the clinics, the types of clinics that you referenced in your question, who do have good footprints within those communities, based upon a racial and ethnic diversity as well as a geographic diversity. Just to name some of the clinics that we worked with for at least a couple of months now, some more than others: Care for Your Health, Mobile Med, Mary's Center, CCACC Clinic, the Pan Asian Clinic, Proyecto Salud. I'm sure I'm missing somebody, but these are just an example of the clinics that we have been working with, and we have been providing doses to directly, again, working with them to also get registered in the Immunet system so they would be able to receive doses directly themselves.
Okay, thank you. I guess my understanding is that those practices that have registered are still almost entirely awaiting shipment. So I'm happy to hear we're at a 1-to-1. I wish the state were providing doses to the practices in a more significant way. It seems like it's an important part of the puzzle. And if, I just put this out there, if at some point, if we think that by giving some of our allocation to them, that would deepen the effort, obviously we would want to consider that. I'm sure that's, something that you've thought of already. But I guess I've just been surprised that we aren't hearing about more individual medical providers, receiving their allocations and then providing doses directly to their patients. I had expected we'd be at that stage in this rollout at this point, and for whatever reason, it's not exactly clear to me. That's not where we're at yet. But having asked about that, thank you. I wanted to make a general comment about where we are in this rollout and in the pandemic generally. I think we're in a moment of great confusion about the efficacy of vaccines, the necessity of additional measures, who they protect, why, and I'm sure this will iron out in the coming weeks. But I am certainly encountering a lot of individuals who aren't yet confident that being fully vaccinated is really a very, very powerful protection that virtually eliminates the risk of serious medical consequences. Does not eliminate the risk of transmission. There is a very slight risk of transmission, but there is very little risk of actual serious COVID, health impact once you've been fully vaccinated. And at this point, we have millions and millions of Americans who have been fully vaccinated, and I'm not hearing about cases of people who are being hospitalized, after they've been fully vaccinated. It's just exceedingly rare. So when you have been fully vaccinated, I think it just gradually, I think we'll all absorb this idea that masking is for those who are refusing to get vaccinated or are unable to get vaccinated, but you're safe around people regardless if you've been vaccinated. That's the safety protection. And I think it's important to gradually make this shift, because I don't know, maybe there are those out there who view vaccinations as one of several things at their disposal that they might do, and either none of them they care about, they just don't care about this and they are one of these deniers, or they think that there's some kind of equivalency. And well, I guess if I just wear a mask sometimes, that's just as good as anything else. And the reality is that being vaccinated is a entirely different kind of protection. And it is a very, very powerful protection that is, at this point, virtually complete. And so you're safe around other people, even if they are unvaccinated. And that is something that I think is not yet in the public dialogue. And it will take some time, and that's okay. We're at a very transitional stage of all of this. But it's also why I think it is appropriate to begin to lift some of these restrictions and make it ever more clear to those who are not yet vaccinated that it's vaccination that's the solution. You've got to go get vaccinated. That's it. End of story. Go get vaccinated. That's how you'll be safe. And I know that there are very few people who can't, but for the most part, those who are not either are refusing or just it hasn't been able to work into their life yet. And I'm glad we're doing more late hour clinic times. I think that's really important. I think we ought to even consider an overnight clinic. But I think of all the employees who are just in a routine with their company, and that's their life, and they go to work, they go home, and they get back up the next morning and they do it again. And I suspect that we're having some issues, reaching them, and we ought to have more and more late night clinics. I wanted to thank you for your comments on the incentives. As I mentioned earlier, I have been working on an appropriation, and I'll have something soon, but I think that will be another important component of reaching those who are yet to get vaccinated. And I think the evidence is rolling in that they are quite effective, and that there are those for whom they might be hesitant or just simply unmotivated, and an incentive will help them. So I wouldn't have thought that would be a good thing for us to do in the early stages with all the population that was highly motivated, but I think we've reached that pivot point. And thank you for your comments on the homebound program. Again, if there's anything we can do to beef that up, more staff we can assign to that. I just think there are some, that group of people, they may not, it's not apparent to all of us, how staff is assigned and so on and so forth. And so it's just something that I think would be really appreciated if we can assign more staff into that. Last thing I want to just observe, I think in regard to the schools, I really think it is time to allow those kids who want to go full time to be able to go. I know a lot of parents are not going to want to send their kids this spring. They're just not going to want to do it. And that's their prerogative. I don't think we would ever consider saying you must send your your children in now if you're not comfortable with that. But so many kids are in these A/B shifts, and now we have vaccinations, we have very low transmission level. Why not allow those families that do want to take advantage of full-time school to be able to do that? And I know it's complicated. The school system has been kind of working at it, but I just think, speaking from personal experience, my oldest son, he's in the group B, and when he goes to school, there's only 3 other kids, and typically in his class, 3 or 4 other kids. I mean, can you imagine going to school with 3 or 4 other children in a room? And he says he doesn't even really get to interact with the teacher very much because the teacher's focused totally on the screen. And he's not motivated to want to return full time. He actually, of course, as a teenager, much happier at home. Wouldn't you be? I would. But, I think we are somehow, this, from a health perspective, there's no question that this can change. And so if there's anything that we could do to facilitate that, I just think it would be helpful. We are certainly where we had always dreamed and hoped we would be in terms of, having a clear path out of this. So again, for those who want it, it seems like we ought to be able to provide that. And I know I recognize I'm speaking more in a public sense here and less to anybody in particular. But thank you. Appreciate your presentations today, and look forward to continuing to work with you.
Thank you. Councilmember Katz.
Thank you very much, Mr. President. Could we get an understanding, please, of the population percentage of in Montgomery County of those younger than 12 years old? Do we know that, who are not eligible for the vaccine?
About 12 to 13% of the population.
About
roughly.
12 or 13%.
Yeah, we estimate about 83% is 16 or above, and then it was 3 to 4% for those individuals 12 to 15, and so that leaves about 12, 13%.
So in order for us to get to, we're never going to get to 100% of the population. I mean, the most we can get of our population would be 87% is what you're saying. And then of course there's those in the 87% that refuse to take it. So, I mean, I think we're doing a pretty good job at this point to have the 60% where we are. I mean, I don't know how much more we're going to get. I mean, obviously the younger people getting involved is a big help, but I don't know how much more we're going to actually be able to get beyond where we are right now, is my point.
If we were a state, Montgomery County would be one among, I believe, the top 5 or so states in the country if we were our own state in terms of vaccination rate. A few states, I think Hawaii has done exceptionally well. They're one of the best in the country in terms of vaccination. If we were a state in and of ourselves, Montgomery County would rank quite highly among the states nationally.
And of course, Montgomery County, I believe, is larger population-wise than 8 states in the United States. So that's a good way to look at it. The other thing that I think needs to be mentioned is, I know anyone over the age of 2 is supposed to wear a mask. So anyone from the age of 2 to 12 right now would still be required to wear a mask. I believe I'm correct in saying that by our definition. Is that correct? Because they can't get the vaccination.
Yes.
And I heard on the news this morning, it was either this morning or yesterday, but I believe it was this morning, that a pediatrician, one of your colleagues, Dr. Gales, said that one of the concerns that they are talking about is that a child who's 10 years old or whatever, if they're supposed to wear a mask, they have to wear a mask, but the parent is not, and whether or not the parent would consider wearing the mask so that the child didn't feel like they were being, that they were having to do something that others didn't have to do. So it's something to keep in mind just for our children. And then when someone, and I know we're going to discuss this later, but for as an example, for the organization swimming and other sporting area organizations, when they received a waiver, when the new uh, uh, ordinances, when the new resolutions go into effect, those waivers are no longer necessary. Do we send out notice, or do they just realize that that is what's going to have to take place, that they don't need to follow the waiver issuances?
We have not typically sent out a notice, but I actually think that's probably a fairly good idea as we go to different phases to let them know that there's been an update and their allowances may have expanded. I think there'd never be. I guess we'd let them know if we had to implement more restrictions in the future, which I again don't think we will have to, nor do I want us to.
But you have to put the asterisk on there.
I'll put the asterisks on there. I think it would be. I think that's a worthwhile thing. We could notify our LOA recipients about, and just say, hey, there was an update to the Board of Health Regulation. Here's what it said. This may expand the allowance of your LOA. Please, you have to look at your individual LOA to determine. I think that's probably a worthwhile thing for us to do.
Thank you. And there again, thank you all for all that you do. This has been, as all my colleagues and you all certainly know, and the public, this has been turmoil to turmoil to turmoil, but we are getting there. And it looks like we're finally going to be getting our public to the point where people will start to feel more and more comfortable. So anyhow, thank you all. Thank you, Mr. President.
Thank you, Councilmember Katz. Councilmember Navarro.
Thank you, Mr. President. And of course, much gratitude for all the collective effort. We have reached a very important milestone, and it just feels a little surreal since we're so used to always talking about just the challenges and the challenges. So it's kind of nice to be able to at least pause and be grateful for this milestone. A quick question regarding our targeted efforts within particular communities. Social media, there were some folks that had contacted me, and some people were making comments about these phases of reopening and relaxing all of these restrictions, but still, of course, communities that are still experiencing disproportionality within the vaccination process, particularly if this was directed to the Latino community. And of course, I responded with the efforts that are ongoing. But can you talk a little bit about now that we have reached this point, before we discuss this issue of we would hit a particular place where there would be hesitancy, or we would just have to start going very, very deep into the community to reach out for those folks and get them vaccinated, those who perhaps just had not had the chance, maybe did not have access to go to the sites. We needed to get to them. How are we doing in terms of that rollout of that much more targeted effort? And just in general, any updates on additional things that we are doing?
Thank you, Councilmember Navarro, for your observations and comments and your question. So to your question, we're continuing to leverage one of the earlier questions, leverage the network of community clinics who are a little bit more flexible in terms of being able to operate within those spaces, specifically within different communities. And so that's nothing new from what we've been doing before. The network of those opportunities has expanded in terms of the providers that we are providing doses to, and the types of clinical opportunities that they are utilizing are different. So their levels of operation are able to stand up, clinics within their spaces, going out to community spaces in terms of at residences and so forth, to do that where they know there's high traffic for folks to be able to get through there. We are bringing on 2 additional partners. One was brought on, I think, in the past week to support them, and strategically in the East County area, that's approximate to a host of those zip codes that, if you think back to the priority map, kind of half or Central County, half or Down County, to help with increased penetration within that network, as well as bringing on some additional groups to alleviate some of the pressure on the county system as we consolidate some of the larger operations and try to do some of the more focused stuff. So what we're trying to do is to, again, continue to support that network of clinics who already have that footprint within the county, and then also be able to consolidate some of our larger operations, as Dr. Bridges pointed out. So that would allow for some of the staff to be able to go out and buffer the homebound population, and to also do some more of those take a surgical knife approach to, again, some of those zip codes that we're trying to also study to understand what the phenomena are that are driving those gaps within those gaps of lower percentages of uptake.
Thank you for that. Coincidentally, this afternoon, we're going to receive a presentation from Park and Planning on the demographic changes of Montgomery County. And it's a presentation that I requested because I think it is very instructive for us to continually understand, our population and concentrations also of particular populations. And I know you've used that data to target a lot of this work, and it has shown results. So, I feel very optimistic that, the issue of disproportionality, which we started to address last year when we started getting the data and we understood, we were ready for that. I think that we are going to be able to address that, and I think it's just super important, obviously, especially at this point of the game, that anyone that is out there that has good ideas or is putting forth a very proactive, targeted type of initiative of any sort or effort, that obviously we want to hear about it, we want to engage. I think we've done a pretty decent job engaging everyone who's already been a partner and has worked there for a long time. And I know we've said this time and time again, we in many ways were fortunate that we had capacity already that we had built throughout the years that we could tap into very quickly and activate very quickly. But obviously we always welcome additional support that we can leverage and put out there. So again, thank you all for everything.
Thank you. Colleagues, any other requests to speak? Any questions? Okay. If not, thanks for this great briefing, especially for all the good news incorporated in it. And we're not used to that, but we're getting used to it very quickly.